Are you a parent of a youth athlete and you're concerned about the overuse injuries and sports injuries that he or she is suffering as a child or a teenager? Well, it happens a lot, and there's a lot of different injuries. We see it in our practice a ton. It's one of our main patient populations of athletes is the teenage athlete and even younger, all the way up into college. And really what's happening is a lot of parents are getting concerned about it because it's happening often. And there's a lot of different conditions that occur. And then the concern is the long-term development of your child, being able to play in that particular season. What are the long-term consequences of this injury? Like, is it going to impact down the road? Is it going to be something where it's happening on and off and not going to get rid of it? And it's a real concern that a lot of parents have, and there's a few reasons why we're seeing an increase in youth injuries, and one of them is early specialization. And so that's the child that's playing one sport only at a young age, like say 7, 8, 9, 10. As you progress into teen years, you can definitely pick a sport, but early specialization is causing a lot of overuse because it's the same movements consistently versus playing multiple sports. We're going to give you a link to an article that really describes the problem with that. So that's a big one that we see. The second thing is year-round, especially in South Florida where our weather is good. We even have parents that move down into Florida for their children because they're at a high level of a particular sport. Let's call it tennis or soccer. But what's ended up happening is they're playing this one sport year-round. Even professional athletes have an off season. And what we're finding is a lot of these high-level teen athletes are playing the same sport year-round, and it's causing overuse without the ability to rest the body. So that's a problem. 3 is we also have to realize that these are developing kids. These are people that their bodies are changing. At age 12 versus age 13, you might grow 4 inches, right? And so they're trying to develop into their body, and at the same time they're putting a lot of stress on it with sport. And that's obviously something that we can't change. We want them to develop and grow, but that's just a reality, okay? And then we have these sports injuries and you don't know what to do as a parent. You're afraid that they may need surgery. You're worried about having to take any type of pain medications for that, or being prescribed 8 weeks of rest of a sport when you really don't have 8 weeks. And that's something that we try to sit down and address and communicate with you is, what part of the season are we in? How bad's the injury? Are there any red flags? Or is this just an overuse injury that is going to get better soon with the proper care? Is it an injury or is it just pain and discomfort? Sometimes as an athlete, we have to know the difference of, we just have to play through this little bit of discomfort, but there's nothing that's structurally going to happen or it's not going to cause it to get worse, and we just have to play through that. Or it's a real injury that we do need rest, we need care, we need communication with the coaches, and we help guide you in that process of figuring out exactly what's going on, give you a diagnosis, give you a cause of it, and then from there we'll sit down, develop a treatment plan around that if warranted, and see if we can get that player better and be able to play or take some rest, right? It's part of the decision-making process. A lot of times with these youth athletes that get injured, it's overuse in nature. Yes, there are sprained ankles and there's knee injuries and there's the traumatic ones, but many times it's just overuse, and we want to figure out what the root cause is, and then from there give you strategic corrective exercises. Maybe it's mobility, flexibility work, maybe it's stability work and some strengthening that we need to give you. We do something called active release technique and Graston technique, which are soft tissue muscle work. A lot of the college and professional sports have providers on their teams that do these and really work on the muscle. So it's a lot of times the strained hamstring or the hip pain. It could be mostly muscular a lot of times with these overuse injuries. So we'll get in there and really work that out and correct the muscle, tendon, and ligament so that when we do give you corrective exercise, it actually works long term, okay? And then we just talk about other things like pre-game warm-ups and stretching, self-care, right? When to use a foam roller, when not to, when to stretch, when not to, ice versus heat, all those different topics. We try to help guide you to maintain your child's return to sport as quickly as possible and prevention, right? And then lastly, we find a lot of these athletes need some type of chiropractic care to help make sure that the joint restrictions are not there, getting proper mobility in certain aspects of the spine and hips and shoulders. And so that's something that we do a lot with our youth athletes as well. Not every one of them, some of it's just muscular, and we do that. And then lastly, we have a full sports recovery center here where we've got the whole body cryotherapy, we got Normatec recovery boots, deep tissue laser therapy, hyperbaric chamber, and that's for where we've maybe are healthy, but we want to stay healthy, stay fresh, make sure our performance is increased, and those modalities really help with that. So we see a lot of athletes here. We've got all the fun bells and whistles, but we also really get down into communication with you, the parent, and making sure that it's just an overuse injury. They're going to get better. There's no red flags. We can get them into return to sport. We can communicate with the coach and then just try to get them better as quick as possible. The good news with all of this is that they are young and they heal really well with the right care. It's amazing how a teenager can heal appropriately when given the right type of diagnosis and the right care, and obviously the right plan to get back into support. So if you have a child and they're not injured, you can call us and maybe get some proactive care with sports recovery and other type of soft tissue work. If your son or daughter is dealing with some kind of sports injury, we can definitely help you out with that. So give us a call at 561-997-8898, and we can set up a consultation to see if we can help your child get back to sport pain-free.